Hello, my name is Jeff. I'm 55 years old and I'm from Pennsylvania. And 2 weeks ago I felt a ping in my hand, and what had happened was I tore my EPL ligament. Your EPL ligament is this ligament that runs from this part of your hand to the last knuckle of your thumb, and it allows you to extend your thumb. This ligament right here goes to your first knuckle of your hand, gives you all kind of movement like this, allows you to grip. My right hand, I do have this ligament, it runs to this knuckle. I have no problems with moving this knuckle at all, or moving this part of my thumb at all. Do have full grip of everything, but I do not have the EPL ligament. The EPL ligament runs from here and to the last knuckle of your thumb, and as you can see, I cannot move my thumb or extend my thumb like I can on my left hand. I'll put my hand on the table. I cannot raise the thumb off the table; it will not come up. So what I did was I met with a hand surgeon, and what they're going to do is there are two ligaments that go to your pointer finger, and are going to do an EIP to EPL tendon transfer. You have two ligaments that go to your first finger. Apparently only need one of those, just like your kidney. So what they're going to do is I'm going to have surgery, and they're going to cut the tendon, or one of the tendons, from my first finger, move it over here to my thumb, and sew it on to the end that tore, that runs here to this knuckle. So after surgery I should be able to fully function my thumb. I researched on the internet and found several videos of the actual surgery itself of the EIP to EPL transfer, but I didn't find any recovery videos of anybody who has ever had this surgery. So I thought I would make a video of my recovery. It's probably going to be a 2-month recovery with hand therapy. Apparently I'm going to be off work for about 2 months. So during this 2 month, I will be periodically videoing my progress with the therapy and my recovery of over the 2-month period. So I hope you enjoy this video. I will talk to you soon. Thanks. Hey, this is Jeff again. Just to give you an update of my surgery that I had. Yesterday was the 26th of September 2018. Today is the 27th, on Thursday of 2018. I had EIP to EPL transfer surgery, where they took a tendon out of my pointer finger, moved it over my thumb so I can extend my thumb. The surgery went well. The surgeon said that I had a clean tear in that tendon, the EPL tendon. As you can see, the cast I have on my hand, the cast around the thumb is a hardened cast. The around my fingers and wrist is a soft type cast, and it's just wrapped in some type of gauze here that they did. I have full motion of my fingers. The pointer finger appears to be normal, as it was prior to my surgery. The pain is substantial, although it is being controlled by medication. I am scheduled for next Monday for hand therapy, where a hand therapist will remove the cast and they will create a splint, where I will be wearing the splint throughout my hand therapy and throughout my recovery. So I will talk to you next Monday or and let you know how the hand therapy goes, and I'll give you an update. Hey everyone, this is Jeff again. Just an update on my EIP to EPL tendon transfer. Today is October 1st, 2018. Today was my first day of therapy, and I went to the hand therapist, and what they did was they actually created a mold of my hand. They took the cast off. I had a half cast on the left side of my hand here, and this is what it looked like when they took the cast and the wrap off. As you can see, there are two suture marks covered with steri strips still on my hand, and then the therapist actually created this rigid mold of my my arm, partially my arm and my wrist. They extended the wrist at 30 degrees and extended the thumb up, and then of course wrapped everything as you see it is here. They gave me some exercises I have to do to start my therapy with my fingers, trying to get them to completely move without assistance. They said I can actually assist the first finger because it's the one they took a tendon out of and moved it over to the thumb. I have another therapy session coming in 2 days on Wednesday, where I will probably start some exercises with my thumb, and I will update you on that at that time. Thanks again for watching. Good morning, everyone. This is Jeff again. Just an update on my EIP to EPL tendon transfer of my right hand. Today is October 10th, 2018, 2 weeks after my surgery. And I just want to show you exactly what's going on right now. I'll take this brace off. 2 days ago I had the stitches removed, and I'll show you what that looks like right now. And as you can see, the stitches have been removed. I had 2 incisions, one incision right here and another incision right here for the tendon transfer. I have full motion of my hand and my fingers. I have not moved my thumb. Right now I'm currently not allowed to move my thumb other than the tip, which I can move that while it's in the brace. The hand therapist said that just do your exercises with your fingers, and we will get to the thumb exercises starting next week. So at that time I'll update you on my progress then. Again, this is Jeff. Thanks for watching. Hello again, everyone. This is Jeff. Just to give you an update, my latest progress of my recovery of my EIP to EPL transfer of my tendon from my first finger to my thumb. Today is October 17th, 2018, exactly 3 weeks since surgery. Yesterday I had physical therapy, and they started giving me exercises to move the thumb, and I'll show you some of the exercises that they started giving me. The first one would be laying your palm or your hand on the table like this and just moving your thumb as you can. It's very stiff right now because it hasn't been used in about 3 weeks. This is the first week that I've actually started using the thumb, or moving the thumb. Another exercise is what they call the puppet hand, and where you're trying to squeeze your thumb to your fingers, and right now this is about as far as I can go. The thumb itself is very stiff, very little pain. It just feels like it's very stiff, and it's pulling, using new muscles now that the tendon has been transferred. One of the other exercises is to try to touch each of the fingers with the thumb, and currently right now this is about as far as I can do that as well. As you can see, this is just a little practice right now doing this. I'm supposed to do this twice a day, about 10 reps each of the exercises. And it's coming along. Like I said, this is the first time that the thumb has been moved in 3 weeks. It was in the splint pretty much the entire time. So as you can see, this is some of the exercises again that I'm to do. Moving the thumb from the outside like this towards my first finger, and trying to close my hand or use my hand like it's a puppet. And this is about as much as I can do right now. It's very stiff right in through here. And trying to touch each of the fingers, putting the fingers together, and right now that's about as far as I can do that. The hand therapist said that I can continue massaging my wrist, putting lotion on it, and working this scar tissue out that from surgery. It's underneath the skin, and just work the wrist and work that scar tissue out. So that's all for today. I'll give you an update maybe next week, and if you like this video, do as much as you can and give me a thumbs up. Hello again, everybody. This is Jeff. Just give you an update on my EIP to EPL tendon transfer. Today is Wednesday, October 24th, 2018, exactly 4 weeks after surgery. And as you can see, I do have a lot of motion between my fingers now and my thumb. What I've been doing is I'm not wearing the brace throughout the day. I do wear it at night when I go to sleep. And I find that if I continue not wearing the brace, I can just do normal function with my hand. It is coming along right now pretty well with the physical therapy. I do have some tightness right here where the stitches are, or where the stitches were, right here and right here. When I bend my wrist, I can feel some tightness here and right here. When I do move my thumb towards my fingers, I do feel some stiffness in the arm in this area, which is probably due to the way it's wired right now with the tendon transfer. So I continue with my physical therapy. Like I said, I'm 4 weeks into this. Last week I could barely touch my first finger with my thumb, and right now it's actually coming along pretty well. So each day as I progress with the physical therapy and the improvement of my surgery, or the recovery of my surgery, it seems to be going pretty well. So I'll give you an update next week. Thanks for watching, and give me a thumbs up. Hey, this is Jeff again. Today's October 31st, 2018. Happy Halloween, everyone. Just giving you an update of my EIP to EPL transfer. As you can see, the hand's doing quite well. I've got a lot of motion between the thumb and the fingers. The physical therapist made a brace for the tip of my thumb. They were concerned with the tip of my thumb to be in this extension right here like this, so no longer have to wear this brace anymore. They want me to keep the thumb in this angle right now. That's the purpose of this brace. So I wear this all the time now. And again, everything's going quite well. I meet with the surgeon next Monday as a follow-up, and I'll give you an update after that. If you will, give me a thumbs up. Take care. Hey everybody, this is Jeff. Today is November 7th, 2018. Just to give you an update on my EIP to EPL tendon transfer. Yesterday I had physical therapy, and they were pleased with how things are going. Monday I was at the surgeon, and again they were pleased with how much movement I have in my thumb. This is week number 6. And they continue to want me to wear the thumb brace, as you can see, but they're concerned right now with getting more strength in my thumb. They're having me do these exercises, holding my thumb up and dropping it down, holding it up, and then trying to get strength in the tip of my thumb to stay extended like that. I do have, again, complete motion in my fingers now. I can touch my little finger. A couple weeks ago I was unable to do that. I cannot do this, in other words, bring my thumb down to this part of my little finger yet, but it's coming. So right now they're just giving me some strength exercises, try to build up the strength in the thumb itself and my hand. They're continuing these exercises. My wrist is doing pretty good. This is about as much as I can bend it this way and then that way. It still has a little tightness in the wrist as it goes, but every day seems to be getting much better. So if you will, if you like the video, give me a thumbs up. We'll talk to you next week. Hi again, everyone. This is Jeff with an update of the EIP to EPL transfer. This is November 23rd, 2018. It's been a couple of weeks since I've updated you. Week 8 since my surgery, and physical therapy is going quite well. They gave me some exercises to do with progressive putty. It's pretty much like clay or something like that. I'm to squeeze this, roll it out on a table, pinch, and just to gain strength in my first finger and thumb. It's going pretty well. The strength's coming back. No more tightness. I'm able to move the tip of my thumb. Not able to straighten it out yet. I'm not sure if that'll ever come back, but we'll see. We're continuing with the therapy once a week. They also gave me a hand gripper to increase strength in the wrist and the thumb. And I do about 20 reps 3 times a day with this. And I'll continue with the clay or the progressive putty for the next week. I do have physical therapy next week one day, and I will update you after that. Keep continuing liking the video and give me a thumbs up. Hey everybody, this is Jeff. Today is December 1st, 2018. Just to give you an update of my EIP to EPL tendon transfer. Everything's going real well. I have full motion on my thumb, full grip, no pain. The physical therapy has ended. I met with a physical therapist last Tuesday, and she cleared me on my physical therapy. I do not need to go to any more physical therapy unless recommended by the surgeon. I meet with the surgeon on December the 10th, and hopefully after that I will be cleared to go back to work. I haven't worked since September. The suture marks have pretty much cleared up, one right here and one right here. Very little scarring. Unless you really look close, you can hardly even tell that there was a suture there or any surgical procedure in this part of my hand. I do have some tightness, just a little bit of tightness in the wrist area, some stiffness there, but that's not no pain at all. It's not too bad. So as of right now, everything's doing good. I will give you an update after I meet with the surgeon here on the 10th, and I'll let you know how things go and what he says then. Again, give me a thumbs up. Hello, this is Jeff again, just to give you an update of my EIP to EPL tendon transfer. Today is December 12th, 2018. Exactly 11 weeks since my surgery, where the surgeons took a tendon out of my first finger, moved it over here to my thumb to give me more motion of my thumb here and more grip and strength. I met with the surgeon on Monday, this past Monday, and he gave me clearance to go back to work. I have not worked since September, and he says recovery has went well, and I'm no longer to go to physical therapy, so I am pretty much fully recovered here. I just want to thank all of the surgeons and the PAs at University Orthopedics Center in Altoona, Pennsylvania, and also my hand therapist at Results Therapy and Fitness in Chambersburg, Pennsylvania. I'll put a link down below. You can check them out if you would like. Again, if you had the surgery, I hope this recovery of my EIP to EPL tendon transfer, or this video would help you understand what I had to go through to complete this recovery of this. Again, please give me a thumbs up if you like this video, and please comment below. Take care, everyone. Thanks.